Each of the 14 territorial health boards in Scotland has an area drugs and therapeutics committee, whose role is to ensure that adequate systems and processes relating to medicines governance are in place in local NHS boards. The Scottish Government recommends that each committee includes a public partner so that the views of people who use the service can inform the committee decisions. Between August and October 2015, we interviewed someone from each committee to find out how they involve members of the public in their work. Of the 14 territorial boards in Scotland, 10 have at least one member of the public sitting on their committee, although 2 boards were recruiting new public partners at the time of interview. 2 other boards have members of the public on subcommittees and their views feed into the main committee. 2 boards do not formally involve members of the public in the work of their committees. Reasons given for not involving members of the public include a feeling that the issues discussed by the committee may be too technical for lay people to understand, and a lack of clarity about the benefits that involving the public can bring. The committees that do involve public partners do so in a variety of ways.
The Forth Valley Drugs Committee, Area Drugs Committee, is really a senior executive committee that approves and notes all the reports from all the various subcommittees. So I have an opportunity to read all these, and then when I come to the meeting, I've usually made notes of something that either interests me or perhaps a suggestion that might improve the wording.
There's been a wide and varied range of speakers that have come to the group to inform the group about some of the things that concern medicine. So they know a bit more about the Scottish Medicines Consortium, they know a bit more about the licensing process, how formulary decisions are made. And so when it's come to the point where we've been ready to invite public partners onto our ADTC or subcommittees, the group of people that we've had to bring onto those committees are better informed than, I guess, lay people taken straight from the general public are about what kind of things concern medicines.
I've recently joined the main ADTC committee, but I've sat on as a member on the Medicine Safety Subcommittee for many years, and I take relevant information from there back to the patient council that we have in Raigmore that meets once a month.
I've been a member of the subgroup that's involved in communications and publicity to try and raise awareness of polypharmacy. My background is in PR and public relations, and I think I've brought some expertise to it.
I take the information that I glean from the polypharmacy meetings back to the Mental Health Network Greater Glasgow, who also support me.
There were mixed feelings about how successful public engagement has been in the work of the committees, with most boards scoring it at least 3 out of 5.
We tend to focus very much on the scientific side of it and the clinical data that we have. Sometimes having a human perspective that is completely different is actually quite useful, and that can be really beneficial at times because concerns that you have might actually prove to be not as great as you feared, and so it can build some confidence about making decisions.
I think my biggest challenge is probably acronyms and trying to work out what they all mean.
Helps the group maintain focus and keep the patient perspective raised within the agenda setting of the group.
Oh, I definitely think it has made a difference because our voices are heard.
It focuses the mind of the professionals around the room that they're not all professionals. They have to be able to communicate with me and look after me as a member of that committee, as a layperson in that committee, and that changes a little bit, not a lot, but it changes a little bit the focus of how John directs the meeting.
I think it reminds them that the committee's about patients, and that I think patients should be the priority at all times.
You can download the full report on our website.